Yeah, I'm going to let you tattoo my face.
You are listening to EMS with your hosts, Erik Axene and Matt Ball.
Yeah, that was my first one. That one up top. They just redid it. That's why it looks nice and clean and fresh.
No, it really does look good.
Yeah, he does a good job. Yeah, but...
And the same tattoo artist do most of your tattoos? Or?
Yeah. Most did pretty much all this sleeve. Did some up here. Definitely the same tattoo shop for a long time.
Okay.
So yeah, they're fun.
Now I know that there's always stories behind tattoos, and I'm sure the same is true with you. Everybody I've talked to, you get them talking about their tattoos. There's stories with everything.
Yeah, stories or meaning. Yeah, some meaning behind them. Yeah, I would say for the most part.
I think, true. When I considered getting a tattoo, I remember in college, that was one of the biggest hesitations, was being afraid that I'd regret it someday because it's permanent,
Yeah. Well, that's why you put it on your arm, because you can cover it up with a shirt. Nobody's going to see it, right? Yeah. Don't put your first tattoo on your face. That would be a mistake.
Well, that's really why we're talking today, because I'm considering getting a tattoo. And I know we've had some conversations online, and we thought this would be a cool podcast.
Yeah.
So it's the meaning behind it. That's why I'm reconsidering it. I used to design tattoos in college.
Yeah,
played football. One of my guys, wanted a tattoo, and I designed exactly what he wanted. He was super excited because he couldn't find it at the tattoo parlor books he'd look through. And then the word spread throughout the football team. Ended up doing a bunch of tattoos for folks.
Yeah.
And then in residencies after medical school, when I was training as emergency medicine physician.
You had tattoo emergencies?
I have had some tattoo emergencies.
You have?
I have.
How so?
Well, let me finish.
Okay, finish this part.
Is cool.
I didn't know about tattoo emergencies. All right, go ahead.
This is cool. So, in residency, like I said, I ran the tattoo removal clinic.
Right.
When I ran it, this means it was just me and the person with the tattoo were removing. Right. Remember, one guy had it was former gang life. He had a tattoo said "F" him all across his chest, and he wanted that off because now he was a pastor of a church.
Okay. Yeah.
And so we would sit there for an hour together for that session and talk. It was really cool.
Oh, I bet.
Oh, so fun. So many cool stories.
For sure.
Because those tattoos really mean something. Sometimes they mean bad things. Sometimes they mean good things. Sometimes they're special memories or whatever, monumental. Like the Iron Man tattoos I've seen at the gym.
Yep, that's a big common one. For sure.
Military.
Yep.
Like the anchor for the Navy. Stuff like that.
Yeah, Eagle, Globe, and Anchor for the Marines. And Yeah, I think people get tattoos for all different kind of reasons. Now, did you design tattoos? Did you ever actually see like any of the finished product?
Yes.
Once it was okay. So
yeah. In fact, the story, one of the guys I designed a tattoo for ended up becoming an Under Armour model.
Oh.
An underwear Under Armour model. And
say that 5 times real fast.
I had, on this particular guy, I had 2 tattoos on his body that I designed. And
now, just to clarify, you just drew the tattoo. You didn't actually tattoo them.
Do it.
But you want to do that.
I do want to do that.
Now we could, you can buy tattoo guns on Amazon.
And you talked to your guy, right?
I talked to my guy. He said he'd let you tattoo me.
Oh, that'd be so fun.
We have a guy that I work with.
I was thinking like a face tattoo.
Oh, yeah. Right on the face. Yeah, I'm going to let you tattoo my face. I will put it in the most... so there's a guy that I work with. He was in the military, and he has a very funny story. It's a terrible tattoo. But you know him. I'm not going to say his name, but you know who I'm talking about. But he has a tattoo on an area that won't be seen by many people. But it was there was a great story about why he got it in the military. And anyway, it's a terrible tattoo, but the story behind it's really cool.
Okay.
Anyway.
Okay, so here's the emergency.
Okay, tattoo emergency. So this is somebody comes into the ER. Well, I could think of like a sympathetic response, like you're getting tattooed, people pass out for sure.
Well, it's interesting you mentioned that actually, because a lot of the dyes are azo based. There's different bases to the different colors, different chemicals, and when you're injecting it into the skin, it can cause an allergic reaction. And so that allergic reaction, people will be concerned about the swelling and the redness and the pain, and they'll come into the ER. Is it really an emergency?
Right.
Yeah, probably not. Bad skin infections and bad, actually, allergic reactions can be life-threatening if it's the bad type of an allergic reaction.
Yeah, like an
but the
anaphylactic.
tattoo reactions I've had several with allergic reactions. You know, they got a tattoo that day and they woke up in the middle of the night with pain and swelling, and they came in with, you know, they had the cellophane on it, you know, whatever. But I did have one that it ended up being an infection, ended up being a bad cellulitis. I don't know what got injected, but maybe some bad ink or what. But his arm was in bad shape, big tattoo, infection, gave him antibiotics. You know, I don't know what ended up happening. But I know that he had a pretty significant cellulitis in his arm. Frankly, I don't even think he would have been willing to be admitted to the hospital, but it was significant. It was hot and angry. I sent him out with antibiotics. But
interesting.
So when I say emergency,
you
know, people come to the ER for those things.
Right.
Piercings too. I mean, things you wouldn't expect, but you know. I don't go into
I can imagine. We won't get into detail on piercing.
You know, we should do a podcast on rectal foreign bodies. I have so many stories.
Goodness gracious. Yeah. Thankfully, I have most of my... most of those stories are in hospital. I haven't had a lot of, thankfully, out of hospital stories like
that. But we should stay on topic.
Anyway, yes, tattoos. So tattoo emergencies, totally see that. Yeah, very important to go to a reputable shop, licensed, you know, talk to the tattoo artist.
Yeah.
You know, sometimes there's tattoo shops you go into where... And I've experienced this. If you're not just covered in tattoos, right? They don't, you know, it's kind of a cool guy thing. They don't really want to talk to you. It's one of the things that I really like about the shop that I go to, the owner who's done most of my work. It's a business. And he's told me that. He's like, this is a business for me. And they're super nice. All the artists there are super polite. You know, if you're coming in for your first tattoo and if it's something small, or you're doing a full sleeve, you know, they're very professional. So if you're talking to a tattoo artist about getting a tattoo, you know, talk to the artist, go to the shop. Make, you know, if you don't feel comfortable, then don't go to that shop. You know, don't go there. So that'd be my advice. But now you were telling me about some study and the like a correlation or something between...
No correlation.
Oh, no correlation. Okay.
No, sorry. No causation. Yes,
no
correlation.
Correlation, no causation. Yeah, association of people with tattoos and lymphoma.
Correct.
Right?
It's a form of cancer, lymph node cancer.
Right.
That's right. Yeah.
So do I need to be worried because I'm heavily tattooed? And
well, you know, when I saw the study,
you thought of me. And
it was
that idiot.
No. Well, maybe a little. No, I thought I'm considering getting a tattoo, like I mentioned, and I got
as the doctor researcher that you are, you did the deep dive into the. Oh, that's funny.
Well, you know, it's actually not my style to do that.
Oh, really?
But when it comes, like
wait, not your style to do what?
Well, to research things.
What?
No, really. No, let me explain.
Okay.
So, you know, my truck got stolen, remember?
Yes.
At the airport.
Yes.
I came back from Philadelphia, my truck was gone.
Yeah.
It sucked.
Yeah.
I was pretty bummed.
Nice.
So one of our colleagues, for example, is a researcher. He does a lot of the research for our content that we produce. And he's really good at it, right? And I like to research, too, when it comes to medicine, me treating my patients. But when it comes to things like I needed to purchase a new truck when my truck was stolen.
Yeah.
You know, that colleague of ours, I won't name his name, but, you know, he's going to look Consumer Reports.
Oh, yeah. My dad does the same thing. My father-in-law, same thing.
And a lot of people are like that. Maybe folks listening to that now are like, oh, man.
And there's nothing wrong with that.
If I had to spend a lot of money, I'm going to freaking research it, right?
Absolutely, yeah.
Not me.
Really?
No.
I would not have guessed that.
No, I just I knew what I wanted, and it could have been the most unreliable truck. It certainly was probably the most inefficient truck that was stolen, right? But it, you know, to me, like if I was really researching it, I'd want to know how reliable it is.
Right.
I want to know
longevity.
This. For me, it was all about speed and power and what I thought.
Well, but you
cool.
did research. You just researched what was important to you.
True.
Yeah.
But I'm not looking at the
Google. What's the coolest truck on the market?
Well, see, that's subjective, though. It's like,
this
is what I think is sexy. Let's do it, right? Yeah. Whereas I think a researcher is going to be, okay, well, I'm going to get all the information on the table so I can make an educated decision.
Right.
To me, I don't like wasting my time. It's like, let's just get her done. And if I make the wrong decision, I'll make the right one next time. I don't like to think too long about things. It's like ordering a meal.
That's good.
Just order a meal.
See, I will overthink things to death.
Really?
Oh, I will contemplate and overthink things to death.
And I know you're very intentional about the decisions you make, right?
Because drives my wife crazy.
Because when you say something, you've measured it, you've thought about it.
Yes.
Because when I say something, I don't want to just blabber or something useless or wrong.
Yes.
I have no problem doing that.
Yeah.
I'm kidding.
I'll tell you what, it's good to do your research because recently, and we're getting a little off topic, but same thing about looking. I've been looking to buy my daughter a new vehicle.
Yeah.
And we had one picked out. And she loved this car.
Right.
And we were about to go to the dealer and buy it.
Mm-hmm.
And thank goodness my wife said, have you checked on the insurance on the car? And I called our insurance company.
I bet you I knew what car it was.
And
a brand anyway.
Yes. Yeah. And it was going to be $400 a month.
Wow.
Just for this car. I'm like,
Get a different car.
We were going to go to the dealership that day, so it is important to research. So back on tattoos.
So back to tattoos. So tattoos to me are permanent. They're really important. I've never gotten one before. I've considered it many times as a designer and a remover, you know. And
you've seen both ends of the spectrum. Yeah. Have you ever been in a tattoo shop?
Oh, yeah.
Okay. So
many times.
Many times?
Oh, yeah.
When you were designing them?
No, even recently in Deep Ellum. Because
You went to Deep Ellum Tattoo?
Yeah.
That's where I got my chest done. What did you go there for?
Well, we were down there with some friends just to grab some food. We went to a concert at the Bomb Factory.
Yep.
And I am an artist.
That's a fairly famous tattoo in the tattoo world. There's some Kat Von D. Oh. She was married to Oliver Peck, I believe is his name, and I don't know if he still owns it. I know he used to own it.
Right.
But he was the guy that's on that tattoo show. And that, I believe, if I'm not mistaken, they were married, and she used to tattoo out of that shop.
Really?
Yeah. So it's a pretty
to me, I was drawn to the art of it.
Yes, for sure.
I look around, and it's like, I respect that.
Yes.
I respect the art. But even when I design tattoos and remove them, I respected that art, but I never wanted one myself.
Right.
It wasn't until my son approached me and said, hey, Dad, I think I'm going to get another tattoo. He already has a tattoo. I don't know if you knew that.
Yeah, he's got a small on his arm, right?
Yeah, right. And he's 18, just finished his freshman year in college, and he's, Dad, I'd like to get a tattoo, and I think we should do it together, get the same one. Mm-hmm. We've climbed a mountain a number of times together, and we thought it'd be cool to get the profile of that mountain with the GPS coordinates. My grandfather was buried at the foot of that mountain.
Oh, wow.
And so we thought that would be a neat tattoo, very meaningful to my son and I.
Yeah.
I'll always be his dad. He'll always be my son. And this is a memory, a very special place for us. So that's why, and the meaning behind it has prompted a reconsideration of my, the thoughts of maybe getting a tattoo.
Yeah.
So what I thought was, something was totally an idiot thing to do, something totally stupid. I'm kidding.
No. There's lots of people that think it's totally stupid.
I don't think that at all.
Yeah, no, I know you don't. Yeah.
So that's why I've reconsidered it. And you brought up the study. Mm-hmm. And so, yes, for this, I researched it. This is important. This is permanent. It's something that, I feel a certain amount of responsibility as a physician to research all of it because my son is, listening to me. As a physician, people look at me a little different when they see health choices. And personally, for me, I'm very careful about what I put into my body. Mm-hmm. Even coffee, this is actually water in here, but, not to drink too much coffee. Caffeine can have an effect on your heart, right? Yeah. So, and the food we eat can have an effect on our longevity, our mortality. And so tattoos are the same thing.
Yep.
This stuff here, this isn't just a covering of our body. It is a covering.
Largest organ
of the body, the integumentary system. And so to me, when you put something on your body, that ink, actually goes into your body, and it actually has been found, a known fact, that the chemicals in that ink are in your lymph nodes. Mm-hmm. And those lymph nodes can become irritated and form a cancer called lymphoma. Mm-hmm. And there have been associations with tattoos and lymphoma. That was in that study as part of my research.
Associations.
Yes, associations. Let me be clear.
Yeah.
An association is a whole lot different. It's called a correlation as opposed to a causation.
Right.
So this study was done in Australia, over 11,000 people. and those 11,000 people in this registry in Australia were giving a bunch of data. And scientists were using that data to see if they could try to find a correlation with certain diseases. Well, not just Australia, but globally, we're seeing an increase in lymphoma cases.
Okay.
Why is that? And so these researchers looked at that data of those 11,000 people.
Tattooed people.
Well, that's what the study found.
Right,
amongst other things, one of the things they found an association or a correlation with tattoos and lymphoma, and it was just and again, it may be related, may not. There are a lot of other factors involved here.
Yes.
But it did show some potential as being associated with lymphoma, and that's what attracted me to the headline.
Sure.
You know?
Little clickbait there.
Yeah, exactly.
Well, you have to look at it too, though. There's a lot more people that are tattooed than if you go back, 20, 30, 40 years ago. There's a lot more people getting tattoos today than there were back then.
Well, 20 years ago, about 20% of the population had tattoos. About 1/5
You researched
of the
that too?
U.S. I did research this, and today, about 30% of people have tattoos. Almost a third of the population has a tattoo.
So yeah, you've got more people with tattoos.
Yes.
So anyway.
So let me talk briefly about this study because I thought it was interesting.
Yeah.
In my reading, I kind of broke it down and tried to, just really wanted to understand the relationship, right? So. First of all, when I say for example, if I said that I had a 20% greater probability of winning a game or a 20% increased chance of doing something, that sounds pretty significant, right? So a 20% increased risk of having lymphoma sounds kind of scary.
Sure.
But you really have to understand what that means because the risk is already very low. For lymphoma, let's just say it was 1% risk, which is actually pretty close to what the risk ratio was. But so if you go from 1 to 1.2, which would be about a 20% increase, I have a 1.0 chance of having a lymphoma because I don't have tattoos.
Right.
Based on the association,
Right.
You have a 1.2% chance. Well, how reliable is that number?
Right.
Because it is a 20% increase, but it doesn't sound so crazy when you think about it that way, right? But it gets even more fuzzy when you look at these things called confidence intervals, where I'm 95% sure that the number for my risk is between a certain range, right around 1%. It's in a range.
Right.
And then for 1.2% risk, that number actually is within a range where I'm 95% confident that number would be in that range. If that range gets wide, the confidence goes down, right? Because, I mean, that would be weird.
Right.
Well, I know it's close to 1.2, and
but it could be 7.8.
Right.
Yeah.
And if our confidence intervals overlap, then it really starts to make the study look pretty poor, muddies the water. Yeah. So that's what was going on in the study.
Okay.
And they did find some things that would, to me, I think, really refutes the association. Like one thing they found in the study, that the size of the tattoo had no correlation. It seems to me if you had more tattoos or huge tattoos, that would increase your exposure, but there was no increase.
It'd be like smoking one cigarette compared to smoking for 20 years.
Right.
Yeah.
Right. So there's a lot of questions I have, which is cool about science, because when you have a study like this, a retrospective study, looking at the history, looking at people, it creates more questions and hypotheses.
Sure.
And then we can design the randomized control trial that can then find causation.
Right.
Where let's run a study to see if tattoos really cause, right? Well, that's really hard to do. But anyway,
that would be kind of hard to do.
So from my perspective as a physician and as a researcher thinking about a tattoo for myself, this study to me didn't decrease my willingness to get a tattoo.
Right. Yeah, and there's people, take for example, I ride a motorcycle, right?
Yeah.
Like we've had, and some people are saying, I can't believe you're a nurse, you're a paramedic, I can't believe you ride a motorcycle. And, my philosophy is I'm not going to live in a bubble. I thoroughly enjoy riding a motorcycle. I get a lot of enjoyment out of it. It's a hobby. I really like doing it. And so, as you know, I mean, I wear, shielded jackets.
Protective
I
gear,
wear a very expensive, very safe helmet. I mean, I don't go riding around in, flip-flop shorts and a tank top with no helmet on. I don't do that. That would be dumb. Yeah. I ride very safe. I try to, be very cognizant about what I'm doing when I'm riding. So, yes, it's a calculated risk, right, when I'm doing that. But, it's like getting a tattoo. It's, if you're going to... my father-in-law has a thing that he puts on his emails, and it says, don't take life too seriously because none of us get out of it alive. And I kind of look at things that way. It's like, I'm not going to really worry about dying because eventually we're all going to die. I mean, you could live in a bubble and only eat pure food and whatever, and eventually we're all going to die, right? Yeah. And so I'm not saying be reckless or crazy, but, if you have a desire to get a tattoo, I'm not going to worry about a small little random study that says that there might be a correlation somewhere about. Did you know? I had a friend give me a book about. It's called Tattoos and Trauma, and it was actually written by a former. I think he's former, or he still might be a active duty firefighter, but he had a really bad incident where there was several line of duty deaths, and suffered a lot of trauma from that. And he went and started getting tattoos, and obviously. Nowadays, especially, I don't know about most, but a lot of firefighters, police officers, EMTs, paramedics, military, a lot of them have tattoos. Some of them are very heavily tattooed. And he was kind of talking about how there might be something there about dealing with like PTSD or whatever you want to call it, where when you go in and you get a tattoo, there's kind of that after getting you go through the pain and the suffering of getting a tattoo, and then you get those endorphins, the dopamine, and all those kind of chemicals, get released. And there might be something to that where it's kind of a coping mechanism almost for first responders or military veterans, things of that nature. Whether it's I've never thought about going to get a tattoo to deal with whatever. But there might be a little bit something there, and that's kind of
another benefit.
Kind of what this book talks about was kind of interesting. And a lot of people will say, like, they find going to the tattoo guy almost like a therapy session, right?
It's interesting you mentioned the dopamine because the whole, in our next podcast, we're going to talk about addiction, but this mesolimbic pathway is to do with dopamine and is really the what's behind that. It's more complicated than just addiction, but that behavior to want to seek something and you really want it. You want to repeat that behavior that gave you the pleasure. And I think it's interesting, though, that a lot of research now is and again, we're going to talk about it, but in some of these drugs and these psychedelics and these dissociative medications that actually have been shown when used, in a controlled environment with the physician overseeing it, you can actually treat depression. And if you look at a lot of the meds for depression, they're actually interfering with some of these things like dopamine and serotonin and all that. So that's an interesting. Back to what you said about living life. I have a friend of mine, and we get together. We say osabuca, and it's an Italian. It's a word. I think it's Italian. I think it's an Italian.
I've heard
dish
the word.
anyway.
I've heard that. Yeah, I've never eaten it.
Basically, a hunk of meat with a bone in it, and it's once you're done eating the meat, you've got a little fork to eat the marrow out of the bone. So you kind of suck the marrow out of life. So my friend and I, when we get together, we like to say that to just suck the marrow out of the time that we have together.
Get all of it. Yeah. There's like people talk about, I don't want to go to heaven and show up in this perfectly pristine. Like I want to slide into heaven, wore out body. Like I used it. I did, wore it out.
Well, there's a balance, right?
Sure, absolutely.
And we talk about this in past podcasts, and we're going to talk about it. And I'm always learning new things in medicine, but we gotta live clean.
Yeah.
Because we have one body, and by taking care of our body, we can enjoy those things that we like to do.
Right.
If you live hard and you're not treating your body right, you're not going to last as long. You're going to die early potentially.
Yep.
And some of those behaviors have consequences.
Yep.
So thinking about what we put into our body, whether it's tattoo ink or the food we eat or what we drink, or the air we breathe, the water we drink, I mean, these really, we got to think about what's going into our bodies, their effects. So back to tattoos, though, I think It's interesting if you go back and look at the history. They used carbon, really. In the 1700s, on the sailors were using gunpowder. They use carbon in the tattoo inks to the black color. Yeah. It's the carbon that actually causes the permanent tattoo in your body. And the colors that you use, the other colors, the reds, the greens, the yellows, those dyes have different chemicals in them to make those colors. And those chemicals are going into your body. Remember, we talked about the skin as an organ.
Go somewhere.
And the lymph nodes are responsible. They're like the garbage cans of the body. If we have a toxin, it gets, or something like a bug or whatever, the lymph nodes are going to store that and get rid of it through the lymphatic system.
Right.
Well, a lot of these chemicals can get stuck. And what the thought is, anyway, is that the chemicals in the tattoo ink are what's causing that lymphoma.
Interesting.
And the reality is, we got to be careful what we put into our body. When you're talking to a tattoo artist or whatever, ask about the chemicals they use. If you're at 50-50, I don't know if I want to use color, maybe I will, don't use color.
Yeah.
Fewer chemicals in your body.
Yeah.
And just think about that. And certain colors, I was reading some of the yellows and the reds have certain sort of a chemical in them.
I'm in deep trouble.
The greens and
I got a lot of yellow
the
and
blues.
And blue.
Yeah.
I got them all.
I really like your tattoos. They look really good. But my point, though, is that the colors, to get a different color, you're getting a different chemical in your body. And I think that's worth thinking about. And that's a factor, too.
A little late for me, but for you can think about.
Actually, but in my medical opinion, though, when you look, you got to look at the data for yourself.
Right.
If you're listening to us and you're considering a tattoo or more tattoos or whatever, you got to look at the data. Sure. Be responsible for what you're putting into your body. What do I think is more harmful, a tattoo or lack of sleep? I think lack of sleep is far more harmful to you than any tattoo would ever be.
Right.
Or mental health, or what you eat, or how much fitness or exercise. I mean, even just positive or negative self-talk. I mean, that's far more damaging to your longevity than a tattoo.
Yeah, exactly.
I don't know. To me, I like to think of the low-hanging fruit in my life. What can I do to be more healthy?
Sure.
And I think the decision for me to get a tattoo is something very special for my son and I, and that relationship. And I think relationships have far more benefit to you than not getting a tattoo.
Exactly.
And that's why I think I'm going to get the tattoo. Yeah. Don't have it yet, but that's
maybe
why.
Maybe next time.
Maybe next time. Speaking of next time, I've enjoyed talking about the tattoos.
It's always interesting. It's funny, being a paramedic, I get, you used to not be allowed to show your tattoos. And at the end of the day, I've never had in 20 years somebody say, oh, because this guy's got tattoos, I don't want him to treat me, right? They don't care. Like, as long as you know. But what's been funny is you'll get the people who you would think would be offended or be bothered by my tattoos would be like little old ladies, right?
You think?
I can't tell you how many times I've had little old grandma in the back of an ambulance, taking her to the hospital, talking to her, and she would look at my arm and go, and they'd reach out and like, oh my goodness, your tattoos are so beautiful. And it really becomes this like conversation, this icebreaker, right? To where people feel like, oh, this guy must be, okay, he's got tattoos, this guy, or if they have a tattoo, like I've had people come up and whatever, but it's never been an issue as a firefighter, paramedic, or a nurse with a patient that they felt like, well, I don't want this guy touching me because he's got tattoos. So I say go for it.
Yeah, I think if people feel that way about something like that, it's too bad for them.
Yeah, that's their
live your life and have a good
about
time.
Yep.
Yeah.
Well, I know a good tattoo shop if you're ready to go.
Well, we've talked a little bit about this. Okay. I think maybe we will.
Can text him.
A couple other folks
see if he's open.
Yeah. We'll see what happens.
All right, we'll see you.
This is really fun. This is a good conversation. Be safe out there.
Thank you for listening to EMS, the Erik and Matt Show.